Holdridge asked basically the same question. So since his name was pulled out, I want to be fair to him. He asked the question about the funding of abortions. I would want Bill to stand up and have an opportunity at a different question since his question has already been asked. Is Bill here?
Yes, I'm here.
Yes, sir.
The next question is, well, I guess I'll say it this way, I'm trying to be nice about it. I don't want to see our government involved in health care, period.
Okay. I really hope you all don't slam the bleachers. This is a patriotic democracy. It's not a sporting event. The more we can allow each other to talk, I think the more progress we'll make. Okay? All right. Can I see a show of hands of everyone in the room who has Medicare? Everyone who has Medicare. Okay. Now let me ask you to raise your hands if you have Medicare and you want to get rid of it. Okay, so we have a whole bunch of folks here that have a government health care program and they like it. And they like it. So, and the irony seems to be lost on people that sometimes the very people who are saying, make sure that the government keeps its hands off my health care, but by the way, don't touch Medicare. That is ironic because, okay, I tell you guys, I hate to use my mother's voice here, because I got 3 teenagers and I got one. But what is it do you think we're going to accomplish if you don't let anybody talk? What is the point? What is the point? Is the point not to let anybody talk? I'm confused. So, and I want to thank for a minute everyone in the room. If you would stand so we can acknowledge you, everyone in the room who has put on the uniform and risked their lives for us as veterans. Years to try to keep those promises. Because any of the veterans in the room know that we've been trying to do it on the cheap for the last decade. We've been asking you to go in your pockets for TRICARE copays. We've been asking you to wait for things sometimes you have. In fact, one of the things I was glad I could do after I did a veterans tour, I found out we weren't even reimbursing rural veterans for their gas money when they had to come to the VA hospital. And I'm not saying we do it perfectly, but I have not met any veterans yet. There may be some in this crowd that want us to get rid of their specialized health care. And they have special health care that the government provides for them. Now, there's 2 systems. There's the VA system and Medicare that are 2 good examples of where the government has been involved in health care. Not perfect, and we got work to do, but I don't think that the idea that the government should not have any involvement in health care, I don't think that dog's going to hunt in America because I don't think most Americans want us to wipe out Medicare.